We recently had someone who came in and brought their child to the hospital. And the heroic efforts of clinical staff, you couldn't have asked for anything better. And unfortunately, they were not able to save that child's life. Because of the on-call chaplains program, we had someone in-house who was there 10 minutes after receiving that call to provide for them a type of compassion and solace that otherwise may have gone missed. I'm eternally grateful for all of the donations that make programs like that possible.
And it was really my grandmother who was so involved with the hospital ever since its founding that drove my grandfather to start the foundation. And I think he did it because he wanted to help the community, help the hospital, and guarantee that the hospital would provide the best care possible to its patients.
I think people don't realize how much the foundation does contribute to what we have and what we're able to do.
The funds that are allocated for nursing research have enabled the education and investigation around nursing practice that can actually save lives.
I think El Camino sees the long-term benefit that you really do reduce the need for immediate services and for emergency services if you're treating people with mental illness in more of a supportive, preventative way.
I've been very pleased to see how a number of people have stepped up and made significant donations. And those donations, in fact, have enabled the expansion of specific programs, both numbers of people that can be handled and also to multiple locations. And we're very excited about the new building. I think that's going to add a tremendous amount of capability both for outpatient programs and for inpatient treatment.
We're very well connected to the cause that the South Asian Heart Center has because we feel it's important for us to contribute to other families avoiding what we've gone through.
The impact of philanthropy on the cancer program has been substantial. Every time that we have asked to go to the next level or to have more services for our patients, we have received funds from the foundation to do so.
So what we've seen historically is that donations to the foundation have had a significant impact on outcomes of patients.
So without donations, without the foundation, without Hope to Health, we don't expand the behavioral science mental health program at El Camino as it relates to women. We don't get pelvic floor physical therapy as it addresses women. We don't get specialized cardiovascular testing for the difference in the microvessel disease that women experience. I give because I'm proud to work at El Camino and I want to pay it forward.
I give because I consider myself as one of those fortunates, one of those lucky ones who has enough to share with others.
I give because it's hard to say no when you see the difference that you're making in people's lives and in the community in which you are a part.
The hospital's been very good to us and we really enjoy and love the hospital. I love being there.
I give because I want to see these programs nourished and expanded and maintained. Without it, we might as well be ordinary and unimpressive.
I kind of go with my heart, and if it's something that touches my heart, then it's something that I try to talk Eddie into doing.
I give because, well, it always makes you feel good to be able to do something for someone else.
True. The more you give, the more fulfilled you feel, and you get back a lot more.
When we donate, we feel like we're playing an active part in patients' lives, families' lives, and the community in a really, really meaningful way.
It is a really joyful thing for me and my family because if we can do something for others, that's probably the biggest thing you can do in this life. So.
It's important for me to continue the legacy, especially after both my grandparents have recently passed away.
Yes, we're a team and we contribute to the El Camino Hospital Foundation regularly.
Giving makes me feel very joyful. It's a very simple act of kindness.
Really heartwarming to know that something that was such a great loss for our family, we've been able to turn it into such a positive thing for other families and other patients here at the Cancer Center.
We've been blessed. Let's pay it forward. Let's help the community now.
El Camino Hospital really goes beyond just being your typical community hospital.
All donors are important, and we all need to sort of feed off each other to create momentum to keep the hospital moving forward.
You know, I look at the foundation as a bright light that shines on the community and the hospital, and touching so many different lives in so many different ways. Who wouldn't want to share in that?